Women in your 30s and beyond, are you tired of being told how to feel? Like all of the products are forced on you? Doesn't it feel like these big companies categorize you when the truth is they don't know you? If anything I just said struck a nerve, listen up. I'm Dr. Jila, an OBGYN and women's health expert. This is my podcast, Her Time, Her Health with Dr. Jila. So, Dr. Mariza, welcome. Thank you so much for being with us today.
Jila, it's such a pleasure to get to be here with you. I'm so excited. We are coast to coast talking about probably a topic that you and I are very passionate about, which is women's health, but particularly women in midlife.
Yeah, I love this topic because, I think a lot of us, our career path just kind of shifts us into this modality and into this journey. And we kind of go along with it. I've read the book, The Perimenopause Revolution. I want to talk about that. But I read it and it resonates. And that's resonating with me as a healthcare provider in this field. I can only imagine what you're doing and how you're helping so many women out there who feel neglected, who feel unseen, unheard, right? And bringing this information to them, it gives them a guideline. Someone's listening. I'm not alone in this. It will get better. So I think women are feeling seen and heard. And that's all due to trailblazers like yourself doing the work, writing the books, doing everything that we're doing. So tell me, you describe all of this perimenopause, right, as a second puberty, neuroendocrine changes. Tell me how that all came about.
Yeah, I love this question. And Jila, I'm just so grateful. I think you and I, even as providers and clinicians, I think we have gaslit ourselves. Because, especially, as a Latina clinician, I was always told in my family that, women suffer and you push through no matter what.
Correct.
And so when I started experiencing perimenopause, I was quick to dismiss it. And often, whether we're dismissing ourselves or we have a provider that's dismissing us, it can be so hard to navigate. Now, the first time that I really understood perimenopause was over 15 years ago. I had just entered my clinical practice and I was seeing a lot of women in midlife, particularly for migraines. Lots of pain-driven migraines. I'm a migraine sufferer. It's what led me to medicine many, many years ago. And what I saw in my practice was not only did my patients have migraines, but they had arrhythmias, they had joint pain, they had weight resistance, low energy. They felt like they were crawling through mud just to get through their day. They were irritated. They were experiencing rage, sleep issues, hot flashes, night sweats. I mean, name it, the cacophony of symptoms that we can have. And I saw that they were getting siloed into multiple disciplines. And no one was putting together or connecting the dots. Even I could see I was like, this has got to be hormones, but I don't know exactly what's going on. Yeah, something is going on. Like I could see. And yet I still wasn't connecting the dots per se, because at the time we just kind of all considered it menopause. And a lot of these women weren't in menopause yet. And so I was like, is this just aging? And my mom really gave me a front row seat to the journey. She was in perimenopause, late perimenopause, where we really recognized it. We didn't understand early back then, even in 2010, but we knew crime scene periods. We knew skipped periods more than 60 days. We knew that someone was knocking on menopause's door at that point, or that maybe it was kind of just menopause. And my mom, I cannot tell you how many doctor's appointments she went to asking for a level of help, because this woman was a single mom. She was steady. She was strong. She was resilient. This woman was a freight train. She was unstoppable. And I remember when she was in late perimenopause, she was a shell of herself. And I saw that. And I was like, gosh, where did my mom go? Like, where did this resilient woman go? What happened? And it wasn't until she was kind of at her breaking point that I ended up taking over her care. She told me, because so often as moms, we're stoic for our children, even when they're adults. And that was when I saw what was going on. She really gave me that front row view of perimenopause. And I thought, we have got to do better. We've got to do better for our moms, for our siblings, for the women in our lives. We got to do better for women as a whole. And I knew then in 2010 that I wanted to be a part of the solution, not a part of the problem. And this has been my life's work ever since. But I will tell you, even though it's been my life's work for 15 plus years, nothing prepared me for perimenopause.
Yeah.
It was destabilizing.
It throws you for a loop, and you don't know if you're coming or going. And you can understand where women come to us and say, I don't feel okay, and I think I'm losing it. I think it's just, I'm going nuts. And it's an out-of-body experience, I think, sometimes, where women just short-tempered. It's not them. I've known my patients. I've known them for 20 plus years.
Yeah.
And I'm like, they never lose it on the front desk person because they're not being seen right away. This is out of character for them. And sure enough, they come in and they're like, I don't know what I just did out there. I'm really sorry. Yeah. And it really is disappointing that even in this day and age, after everything that's out there now in terms of education, information, advocacy, women are still being dismissed left and right, I think, by providers due to lack of information, unfortunately.
I've had the opportunity to have conversations like this over the last several months, particularly about the book, The Perimenopause Revolution. I hear it from my patients all the time as well. A patient comes to me and they're pre-diabetic, but they're told their labs are normal. Or a patient comes to me and is put on, she's put on a combination birth control pill, and she was having sleep issues and irritability and rage. And, she had a tubal ligation 10 years prior. She wasn't going to get pregnant, and I remember but it's different. You have your patients, but I've been out in the community on this book launch and I've been talking to women and they're like, where is the secret society where we can get HRT? And these are women who are like, I'm advocating hard, and it's still hard, and I was at a Dia de los Muertos party over the weekend, and I met all these preschool moms that are in their 40s, just like me. It's like a bunch of preschool kids running around. And then there's these 42, 43, 46-year-old women. I was like, this is us.
This is it.
Like, this is what we're doing.
This is perimenopause
exactly.
right here.
And I had a woman who had a provider locally who was like, birth control for perimenopause, HRT for menopause. Right. And it's not that, birth control can't solve some problems at all. I just mean it's hard for us to have a more nuanced conversation about our symptoms and, what really is driving some of those symptoms. And, oral micronized progesterone would have been, oh my gosh, would have been the game changer for her, and so it's, I know that there's so many women trying to navigate this, and lifestyle medicine is, it can be so beautiful and helpful and needle moving. Having providers who really understand what's going on with women in this transition, that is what I hope this book brings to the forefront. It's how we can have a more nuanced conversation, a more compassionate conversation about what our patients, what our women are going through.
And I think it needs to be more individualized, personalized, woman to woman. And, no two are the same. And like you said, if they already have permanent contraception, you know what? Maybe there are other things to look at then. It's not just a birth control pill. I love that you said you were with all these 40-some-year-old moms, at the party. So let's talk about the moms, right? Because women are having children later, right? And then here we go from all that hormonal shifts from pregnancy, postpartum, and then they kind of segue themselves into perimenopause without even realizing it. Right? Well, that's a big part. Big two major hormone shifts back to back. I will tell you, this is why I was blindsided by perimenopause. I had my son when I was 41 years old. I'm one and done, and he is the most incredible little light being. I am so grateful. And I'm not going to lie, 2 years into postpartum, that was a tumultuous journey, especially at 42 and 43 years old or 41 years old. Right. And I remember coming out of postpartum feeling good. I was still breastfeeding because I was like, if I'm having one, I'm going all the way. I'm doing it all. I'm doing it all.
Like, I'm co-sleeping, I'm breastfeeding, no stone left unturned in terms of like how I showed up as a mom. And every mama gets to do what feels right for them. This kind of felt right for me. And I remember coming out of that 2-year postpartum journey, and I felt pretty good. Like I had gotten my period back about 6 months prior because it took almost 2 years to get my cycle back on sync. And I was sleeping through the night again. I had energy for workouts. I had energy for work. I felt like my brain was firing on all cylinders. And I thought for a moment there, I was like, I'm going to shove back perimenopause. Because the average age that women were coming into my practice where they felt like something wasn't right. I'm not saying that 43 was the year. I think a lot of times women are even in 41, 42 and things are shifting, but it's around 43. It's like, it's undeniable for so many of my patients of like, something isn't right. I don't feel like myself anymore. And so here I am, 43 years old, 43 and a half. And I'm like, I'm kicking butt, taking names. And I'm thinking, okay, let's reproductive longevity. Let's go.
Right. You're like, I've got this. I'm doing good. I got this.
This ain't my mama's perimenopause.
Right. Okay.
Her menopause has been epic. Her perimenopause, I think it took her by surprise too. But man, when she got a hold of it, she was unstoppable. She still is at 65 years old. She's just unstoppable. But about 5 months into me feeling pretty good, I feel like I fell off the proverbial cliff. And I started experiencing a lot of those early perimenopausal symptoms. I started waking up on day 22 of my cycle feeling like life was insurmountable. I started having those rage moments. I started noticing my stress tolerance just wasn't the same. And most importantly, my executive functioning, my ability to really process complex patients that were coming in or creating content for my patients, looking at labs, all of the executive functioning we do every single day. And it was starting to slip beyond my grasp. And I couldn't handle the 100 tabs anymore. I had to be much more focused. And I was like, what is going on with me? Like, I don't feel like myself anymore. And it took me a couple of months to finally figure it out after I've seen it for over almost 2 decades that I was officially in perimenopause. Like,
it was fine.
It was perfect. They were optimal. I'm talking all the labs too, like highly sensitive CRP, my hormone labs. I was like, come on, give me a clue.
Give me something.
Give
you
me
were
something.
hoping for something to be off, right?
Just
Justify
validate
what was happening.
Yeah.
Validate what was going on. Yeah.
And I knew that perimenopause was a clinical diagnosis based on symptoms. I knew this. I knew it was based on age, menstrual cycle changes, and symptoms. And yet still, I was gaslighting myself in the process because I was like, this is stress. This is me having too many things on my to-do list. Maybe this is just aging. Maybe this is still postpartum. And I think that's a lot of what happens to women when they go from postpartum to perimenopause. We're trying to figure out what is going on with our body when we feel like we should be given more of a runway.
So many women fall through the cracks with this, I think, and then they lose. I've seen them where they come in, they're like, I've been going through this for 5 to 6 years. So they feel they've lost out on quality time with their kids, time with their family, because of literally how they were feeling. And some women will retreat. They will become introverts because they just don't feel well. They don't want to yell at anybody. They don't want to lose their temper. So they're like, I'm just not going to go anywhere.
Yeah. That was my mom.
Yeah, right.
She would stay in her house 4 to 5 days out of the month because she was afraid she was going to snap at somebody or yell at somebody in the parking lot or just not show up the way that she wanted to. The standards are so high for how we are supposed to show up every single day. And man, when it feels like your brain is being hijacked by your hormones or who knows, you don't know exactly, it could feel like a lose-lose game. Like what do I do about this? And this is why I knew I needed to write this book. I knew I needed to help women understand what was going on, not only with their body, but also with their brain, and also have a pathway through, because we don't deserve to suffer needlessly. We deserve a whole solution, not a half solution. And we deserve the best of things, not the least of things or what's left. And so often we get what's left.
Yeah. So, you call the book The Perimenopause Revolution. What do you mean by revolution in this context? And what are we revolting against?
I call it a revolution because women are demanding to be heard. Women are demanding validation. They're demanding a new level of care, of perimenopause and menopause care. We are tired of being ignored. We are tired of being told that our symptoms are just aging or that we should just get over it. And we are calling in a new level of advocacy. And it's because of the collective voices of this movement that perimenopause is having a moment. I want to say that it's because of the providers. I really do. And mind you, providers are out there shouting from the rooftops as well. But I believe that the initial revolution of perimenopause was really from women feeling outraged that they're like, wait, this entire 10 years that I have been suffering needlessly, it was because of a profound hormone shift and no one told me. And so I think that women are like, no, we demand better than this. And we demand to be heard. It's 2025.
Yeah. We have to do better.
We got to do better.
And that's what all of this is about. And, I have to give credit where credit is due. Social media has helped quite a bit.
Yes.
Right?
That's where the collective voice is, right? You have a friend who puts something out there and it deeply resonates with you. And you're just like, I need to say this. My mom, I was talking to my mom on the phone yesterday and we were talking about this journey, perimenopause. And she's sharing the book with all of her friends, although she's 65, but she's got some friends that are in their 40s that are going through it. And she says, in the corporate world, she's like, I grew up in the corporate world, especially in my 40s and 50s, hearing from men that women were crazy, especially in the perimenopause and menopause transition. And that was just okay to say. And she's like, this is what the revolution is all about. She's like, that people understand what women are truly going through, that they have compassion and empathy, and that we change the way that the workplace is ran to a deeper understanding of what women are going through, that they are not crazy, that this is a neuroendocrine transition that deserves our utmost respect and the deepest level of care. And so it was interesting talking to my mom about that yesterday, about even just in the workplace, how we are talking about women in midlife and how we need to change the narrative.
Remember, all the stats are there for women in work, right? All the top C-level suites, they're dropping out because they can't compete. They're being overlooked for promotions. Why? They're moody and they're this, they're underperforming. But why are they underperforming? Maybe they're going through something, and that we need to have more conversations about that in the workplace.
We do.
And those are all things that are moving at the same time frame that what we're talking about in terms of getting the care you need, getting the provider who understands it, will give you the time that you deserve and give you the treatment options that are available to you. What are some myths that you want to bust for women out there? Give me the top 2, 3 that really get you sometimes.
Number 1 is that perimenopause is a window of chaos, which I agree with that per se. What I mean is that it's going to settle out in menopause. And what I want women to understand is that there are silent shifts happening that we don't always feel. Women don't feel their blood glucose creeping up towards prediabetes. Women don't feel their blood pressure creeping up to hypertension. Women don't feel the loss of the bone in late perimenopause leading to menopause, or the loss of their muscle. They don't necessarily feel that they're becoming more metabolically compromised. And what happens as we step into menopause and beyond is that we come in with these silent shifts. And I think dismissing women to be like, oh, well, it's, perimenopause, it'll be over. But what about the silent shifts that we aren't future-proofing women's health around? That's a myth that I want to address. That this is about longevity. This is about your vitality. This is about future-proofing your health. This isn't just about symptom management in this zone of chaos. It's so much more than that. Number 2, obviously the myth that we've been talking about just now, which is, oh, you're crazy, or you're making it up, or it's just aging, or it's just stress, or just the level of gaslighting and dismissal that I see, when we really need to recognize the profound transition that perimenopause is. We need to understand that it is far bigger, or more comprehensive, and more just, it's a full body experience. This isn't bikini medicine. This isn't just reproductive health. Right. So that's number 2. And number 3, that women are just going to gain weight and there's nothing that you can do about it. Those are going to be my big ones. And the last one, number 4, if I had a bonus, is that you need to wait until menopause for hormone replacement.
Again, it really is disappointing with every one of us out there talking, kind of giving the same message, that it's still coming back in our communities with our other providers that we've known for years. And they're like, but you're not there yet. You haven't skipped your period. You don't have any hot flashes. So just wait. So wait until everything is going chaotic around you and you're losing it everywhere. Then we'll get you some treatment. Why?
Yeah, just wait until you're osteoporotic. Just wait
Yeah.
until
Right.
you are pre-diabetic. Just wait until, you've developed this sarcopenia. Like, we're done with waiting.
Right.
Women
Right.
are done with waiting to see what happens. And that's the thing I wanted to make clear in the book. Women deserve an answer more than let's just wait it out. They deserve a roadmap. And the beautiful thing is, a big part of what I wanted women, because I get that providers like you and myself, and again, it's a small percentage. Like, you go to rural areas, you go to multiple areas around the country, and you just can't find that provider that's got menopause and perimenopause experience. And again, this is a deeper issue than the provider having a knowledge gap. It's the medical system that we just haven't supported women. We know
It let
that
us
it's clear.
down. It
Yes.
let everyone down.
Yeah. We're making up for the fact that we weren't doing clinical research or diagnostic research on women until 1993, not in a meaningful way. And so we just have a lot of catch up to do. And as a result, a lot of the things that we can do in perimenopause are lifestyle medicine. I wanted to be able to offer simple, practical habits that would move the needle in a profound way. I wanted women to experience wins. I know when my patients come to me, they're like, Dr. Mariza, I need a win. I need a win to get me to tomorrow. And that was how I built the book. I built the book from the standpoint of my own struggles with perimenopause, but also as a mom in midlife who I think I deserve a couple wins here and there, that I get clear on my non-negotiables that help me thrive, that help me show up to be the mom and the doctor and the businesswoman and the friend that I really want to be in this world.
Going off of that, the book offers a 5-week lifestyle plan.
Yes.
Covering the metabolism, the hormone, brain health, energy. Break it down for the audience, because I think that is something I haven't really seen out there. And I think it's so special and unique about this book that, like you said, it provides resources for other people who may not have access to providers such as yourself.
That was the number one thing. I came in from the lens of accessibility. Like, I know you and I feel the same in terms of we want HRT, we want these tools to be widely accessible, right? I would love for that to be the case, but that's just not where we're at yet. We're going to get there. I believe that wholeheartedly.
Yep.
And I know you do too.
100%.
Right? We're getting there. I don't know how long it's going to take, but I'm holding the vision for sooner than later. And I also want women to know that they are the CEO of their health. There is so much that they can do from the comfort of their own home to really move the needle. And I think sometimes having a plan that we can follow where you don't have to second guess, you don't have to wonder if it's going to work for you, and it's tailored to you. I built this plan in a way that women can make it and tailor it to themselves. Because women, like we talked about from the get-go in this conversation, it's about tailored medicine. It's about personalized care. And it's hard to do that in a book, And so I did my best based on all of my years of experience. I was like, okay, how do I create something that is tailorable for every woman who reads this book, and that she can go and walk away with a plan that she can implement for herself? So the first part of this 5-week program is all about mindset. It's about getting clear about who you want to become. It's about getting clear that you are not just mitigating symptoms, you are setting your future self up for success. And I ask those really important questions. This program is basically, let's say 30 days, because I think all of us can we can get down with a 30-day program. We can say yes to that. And so every time I work with a patient, I always ask them, what would you love in the next 30 days? What would you love to experience more of in your body? And so I ask these questions so that women can get clarity. I feel like when we're clear about what we want, we know how to go after it and get it. We also know how to execute on that as well. I mean, that's the superpower of women, where we are unstoppable when we're clear about what we're going after and we've got a plan to follow. So that's the first step. Then it's all about creating these metabolically healthy meals and being practical. So I want to be thinking about your cellular energy, your mitochondria, your blood sugar, and also your gut microbiome. I want to be thinking about all facets of your health that are driving you to feel energized. And I show you how to create these meals in a very practical way I give you recipes, I give you a meal plan, but note that those are just guiding aids. I want you to be thinking about breakfast, lunch, and dinner from the standpoint of how am I protecting my future brain? How am I protecting my future self? And so I share how you can add more fiber to your diet, or more probiotic foods, or more omegas, or more protein, because I want it to feel doable. And then I build in a workout routine. And I know that a lot of women who are starting working out for the first time, maybe they're not lifting weights. Maybe they need a body weight protocol that they can do in their living room while their kids are building Legos, and building exercise snacks, movement snacks around dinner and meals, so that you are feeling so good on the back end. And then self-care rituals that help you just feel like you're prioritizing you, because we need to send our brain safety signals throughout the day so that we can regulate that nervous system. So all of this is built into the plan, along with sleep strategies. And when you finish it, you learn so much about your body, so much about what worked for you, what maybe you need to tailor. And from that, you get to go back, kind of reassess, and come up with your non-negotiables. And I give examples of non-negotiables, whether that's walking 10,000 steps a day, whether that's moving after meals, or practicing gratitude, or having a sleep routine like it is $1 million meeting, wherever, whatever moved the needle for you in the most meaningful way. Now you get to get clear on those 5 non-negotiables that become your daily stack, your habit stack, so that you are thriving. We not only want to mitigate symptoms, again, we want to do so much more than that. We want to optimize your health.
Yeah, and I think for far too long, people thought about a lot of these treatments that we talk about as just kind of covering up the symptoms. No one's really looking at root cause medicine anymore. We've been taught to be so reactive, I think, is wait to get the disease, then treat it. And now there's this crossover where it's like, wait, let's not have them get the diabetes. Let's not have them get heart disease or, osteopenic and osteoporotic fractures. How do we do that? Well, let's be proactive when they're in their 30s, when they're in their 40s, give them these tools, have women optimize their health and well-being with the goal of living longer, but also living healthier.
Agreed.
Right?
It's a scary realization when you watch your mom or your aunt, or maybe even your grandma, if she's still around, watch her become frail, watch her have a hip fracture, watch her get a diagnosis of dementia or Alzheimer's. I can't tell you how many times my patients come to me and I ask them, what would you love? And they said, I don't want dementia like my mom.
Right.
How do I mitigate that? I know that I'm in my late 40s. I'm in my early 50s. What can I do right now to stop the progression of something like that? And this is what I think women are asking for. They're looking for, because they can see it in the horizon, right? And I've been very transparent even about my sister. I have a sister who's 2 years younger than me. So I'm 46, she's 44. And she had a stroke at 42 years old. Very, very, very young, lifestyle driven. But still, my mom is the only one of her siblings. She has 2 brothers who hasn't had a bypass. My uncles have had bypasses. My grandfather had a bypass. The Mexican side of my family, a lot of heart disease. I've been working with my mom since perimenopause, where she saw her older brother have a bypass at 55 years old. And so she's like, okay, what do I do? Mariza, what do I do to mitigate? I'm proud to admit that my mom has good metabolic health. Still to this day at 65 years old. We get to own our health. We get to mitigate. We don't have to be reactive. We don't have to wait for a pre-diabetes diagnosis or a type 2 diabetes diagnosis, or to, get a DEXA scan that says that we have osteoporosis. We can start as early as our 30s and our 40s and reclaim our health, and watch that every single day. I watch women deciding that they get to have a different midlife story. It is possible for each and every one of us.
And so, as you said, with the different cultural backgrounds, how do midlife hormonal shifts present in the Latina community versus the African Americans? How have you seen it evolve?
I love this question. And I talk about this in chapter 1 of the book, because it's important for us to understand the disparities between ethnicities. And we know that African American women will be in perimenopause longer. They will also because it starts earlier for them.
Yes. And more intense.
The mood related symptoms, the depression, the anxiety, the menstrual cycle changes across the board. It's pretty intense, but particularly the neuroendocrine transition can be a lot. And I think this has a lot to do, we don't exactly know. This is based on the SWAN study specifically, but we know that there's trauma. We know that there's trauma in our epigenetics. We know that there are hardships that are happening in African American cultures, especially for women in Latin cultures. I saw that with my family. And with Latin women, we see more prediabetes. We see more metabolic issues, hot flashes, night sweats happening earlier, vaginal changes. So a lot of general urinary symptoms of menopause, vaginal estrogen, issues with vaginal estrogen. We're losing that estrogen probably sooner than expected. So low libido and vaginal dryness, those UTIs, and that's what we'll see in the Latina population. But yeah, we see it across the board. In Asian American populations, it's a little bit lesser of the symptoms, and menopause is pushed back a tiny bit more. With Caucasian women, we're still seeing struggles there too, but not as severe and not as long lasting.
Right. I think the other ones, and we even know with the hot flashes, the severity of them is correlated to heart disease. So there's so much out there that women understand, and they're advocating for themselves. And like you said, we need to be the CEOs of our own healthcare to be proactive and preventative, basically, going forward.
Yeah. Agreed. I agree 100%.
There's so much going on, but I think looking back at our grandmothers and our moms and other generations, we see what the future could look like. And then the goal is, let's shift that. Let's change it. Let's make it better. That way, we don't end up the same way, or avoid that altogether. And hopefully the goal is future generations will not have these barriers to care, and they will just kind of glide right through it. And I can see them already starting to look for the information. They're asking. 30-year-olds are saying, okay, what do I do? What do I need to do now? What do I need to implement in order for this not to be so bad for me? So it's words getting out, and people are educating themselves.
Agreed.
So I have some rapid fire questions for you.
Yes.
Okay. What's one commonly missed lab or biomarker that you look for?
Fasting insulin.
Right? Not the hemoglobin A1C. Everyone goes after that one. I'm like,
no,
nope,
fasting insulin.
You're missing the boat.
We can have insulin resistance up to 10 years before we begin to see shifts in hemoglobin A1C or fasting blood glucose. So I want to look at your fasting insulin.
Correct. Love it. I do the same.
I love it. Yay!
But the thing is, we're teaching ourselves these things, right?
Yes.
Nobody taught us any of that.
Nobody. Yeah, or highly sensitive CRP. We weren't looking at that.
It was like, look at a cortisol level. But that, what does that tell you? It's not as specific.
Yeah.
These biomarkers are so much more interesting, and we get so much information out of them. Okay. What else do I have for you? In terms of strength training for women.
Yeah.
What is like your go-to? What is the one thing that you wish everybody would do?
I wish women would know that they don't need to spend 50 minutes in the gym to get it done. You could be intentional with 20 to 30 minutes max. My recommendation is progressive overload. So, for example, I know we hear a lot about lifting heavy. Well, what does that mean? That means that if you've been lifting those 5 pounds or 8 pounds or maybe 10-pound weights for the last 6 months or 6 years, it's time to level it up. By the 2 to 5 pounds up. So I tell women, grab the 12s and 15s. So let's move up in progression in terms of those weights. The other thing I tell women is that minimize the HIIT training, the 50-minute HIIT training workouts. That I see so many of my patients burning out in HIIT workouts. If you've got the capacity, always prioritize walking and strength training first. And then if you've got some bandwidth, like if you are feeling it, add in one HIIT training class. And I have Hashimoto's thyroiditis. And so I'm always really mindful. I used to do the HIIT training classes and I burned myself out as a result in my mid to late 30s. And so I will go and do a HIIT class once a week. But instead of staying the whole 50, I'll leave after 30 to 40 minutes. Like if I know I'm hitting my wall or I'm getting close and it's 7 a.m., I got a lot of day left, I'll just leave after 30 minutes. Like I can get my 30 minutes and go. So don't think you have to stay the whole time. It's your money.
Right. And you have to listen to your body.
You listen to your body.
You have to listen to your body.
I love my HIIT classes. I like when someone else is training me, but I don't have to stay for the whole class. I can leave after 30 minutes.
I love that. That's great. What is one thing you wish every woman understood about perimenopause and menopause?
That it is not the beginning of the end or the beginning of your decline.
Right.
We need to get rid of that narrative right now, today. This is the start of you stepping into the most powerful chapter of your life because you get to decide it. You are standing on your hard-earned lessons and accomplishments, and you have lived a life. And you get to catapult from those accomplishments and those lessons into a life of freedom, into a life of boundaries, and really prioritizing you in a beautiful way. That's what I want women to know.
Yeah. I love the power and the wisdom that we have at that juncture. And it's like, come on, we're unstoppable. Just reinvent. You never know what the next chapter is going to look like.
Yes. And you can shore up your health. I will say, man, we are a lot stronger and more powerful when we feel healthy and we feel resilient. Yes. But we can do that. We can build that health. We can optimize our metabolism. We can at least maintain muscle, if not build muscle. We get to do this. You know, I think there's still this narrative I have with my patients who just think, well, they're aging. It's over.
It's over.
It's not over. I was like, I'm not buying into that.
I'm not done.
Who sold you that? Let's send it back.
100%. I'm like, well, I'm not done. A lot
Me
more
neither.
to do. So you're coming along with me and you're going to find your voice too. And they're like, okay.
I love that.
All right. So finally, where can our audience find you?
My favorite place is going to be Instagram. That's where we connected.
that's how-
So I've seen you on the stages. I've seen you with Mind Body Green with Colleen. So I've been knowing about you. So Instagram is a beautiful place to connect. My podcast, Energized with Dr. Mariza. I'd love to have you on. I've been doing that podcast since 2018, and it's really where I want women to feel well-resourced about how to navigate perimenopause and menopause, ultimately midlife, but on their terms to feel powerful and resilient. And then the book, it's available everywhere books are sold, including if you've got a Spotify account, you can listen to it on Spotify. You can get it on Audible. I'm an audiobook girly.
Same here. Yes.
I feel like any midlife woman is, because we are so like we're in the messy
We're
middle.
go.
Yeah, go.
Go. It's in
Thank
the car.
goodness for
I listen
earbuds.
to books. That's
Yes,
it.
exactly. And I have bonuses, some really incredible bonuses, more workout videos, more workout plans, more recipes and meal plans. I have a blood sugar friendly mocktail guide. Get your hands.
Wow.
I mean, I've got some
Amazing.
really sexy guides that just help you to feel good. Like I want women to feel good. That's one of my favorite mantras. It feels good to feel good. You can grab the bonuses at drmariza.com, drmariza.com/book, because I want you to have the best of everything, not the least of things. And that's how I stacked these bonuses.
Okay. Thank you so much for spending some time with me today. My audience is going to go crazy over this. I appreciate
thank
having
you.
you.
Thank you, honey.